One of the most talked about moments in late pregnancy is what happens when your waters breaks. What does it actually mean? What should it look like? And what are you supposed to do next? Well, I'm Brooke. I'm an obstetrics and gynecology doctor and a mum, and I'm going to walk you through exactly what happens when your waters break, what signs to look out for, and how to know when it's time to call the maternity unit. So what does it actually mean when your waters break? Well, when people talk about waters breaking, they're referring to the rupture of the amniotic sac, which is a fluid-filled membrane that surrounds your baby in the womb. This sac helps to cushion and protect your baby during pregnancy, and all that fluid inside is called the amniotic fluid. When your waters break, it means that the sac has torn or ruptured and that fluid is able to leak out. It's also called spontaneous rupture of membranes, or SROM. So it can happen either before labour starts, which happens in about 10% of pregnancies. It can happen during labour. So as the cervix is dilating, it pops that bag of fluid, and it can happen any time from when you're 1 centimetre up until when you're fully dilated. Or your baby can even be born still in the sac. Sometimes your waters might actually need to be broken by a midwife or a doctor in order to help things to progress, because breaking your waters helps the baby's head to come down and allows us to use gravity to encourage contractions. What does it actually look like when your waters break? Well, the truth is, it's not always a dramatic gush like you see in the films. For some people, it might just be a slow trickle, just like this. You might just notice a bit of wetness in your underwear. For some people, there might be a bigger leak. So if there's a big break in that bag of fluids, when the waters come out, it might come more like a gush. This can soak your entire underwear, run down your legs, look more like what people typically imagine their waters breaking to look like. And for other people, that bag of water may never break. They don't see their waters breaking, but they continue to have contractions. And the baby may even be born in that sac of fluid. So you might feel a popping sensation, a slow, steady leak, just some wet underwear, or you might not notice anything at all. What should you do? Well, I want you to note the amount of fluid, but also the colour and the appearance of the fluid. Now, once your waters are broken, they're going to continue leaking all the time. So every time you stand up, you'll feel a bit more water come out. That's normal, don't panic. Amniotic fluid itself is usually clear, maybe not quite as clear as this water, but it might be a bit straw coloured, so a bit yellowy, and it has a bit of a sweet smell. I can tell you that midwives and doctors can often explain they can smell amniotic fluid. It doesn't smell like urine. However, sometimes that fluid can look different. It might be pink tinged, meaning there's a very small amount of blood, which can be normal in early labour as your cervix is opening to have a tiny little bit of blood. So pink stained fluid wouldn't be of concern, but if it's bright red, so that indicates fresh bleeding, that is of concern. Also, the fluid might be green or brown, and that can indicate the baby's done a poo inside called meconium. Definitely if you see green water, that needs medical attention. And then you can have cloudy or foul smelling fluid. That can indicate an infection and again should be checked urgently. So after your waters are broken, it's a good idea to wear a maternity pad, no tampons, and let your midwife know. So what should you do next? Well, if you think your waters are broken, here's what to do. Firstly, note what time it happened, so how much fluid that you noticed and what colour it was. Put on a pad so that you can monitor the leakage ongoing, especially if you're not sure if your waters are broken. Putting a pad on can help to see if there's more fluid, for example, when you stand up. You should call your midwife or your maternity unit, but you should definitely be ready to go in for assessment if you're under 37 weeks pregnant, if the fluid is green or brown, or it's got an unusual or foul smell, or if you've got signs of labour, so you're having contractions as well as the broken waters, if you've ever noticed any reduced movements, or if you already know that you've got GBS or groupie strep. But otherwise, if your waters break, everything else looks normal, you don't have any risk factors, you don't necessarily need to rush into the hospital like you do in the movies. You should call your midwife and they'll probably invite you in for an assessment. When you're there, they're going to check your baby's heart rate, possibly do a speculum exam to confirm the fluid, and they can discuss the next steps. 60% of women who have a pre-labour rupture of membrane, so their waters break before they have regular contractions, 60% of them will go into labour within 24 hours. However, if your labour hasn't started after 24 hours from when your waters broke, you might be offered an induction of labour. I've got another video on this. And the reason is because once that sac of waters has broken, there's a slightly higher risk of you getting an infection over time. So after this time, after your waters are broken and it's been 24 hours, you'll be offered antibiotics regularly until the birth of your baby. You'll also be offered antibiotics if your waters are broken before you were at term, before 37 weeks, or if you've got known GBS. So while that moment where your water's actually broke can take you by surprise and it can be a bit messy, it is an important part of labour starting. And it's important that you know what to look out for, that you stay calm, you keep sticking to your calm breathing techniques, and you let your midwife or your doctor know that your water's broken and they can help you to plan the next steps. So if you found this video helpful, please like it, subscribe, and share it with someone who is also preparing for birth. If you've got any questions, do leave them for me below.